therapist, physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're going to try to give you some guidelines today on how to choose a mattress for back pain or sciatica. Some of this is based on research and some of it is just based upon
our experience,
clinical experiences. So this video is a part of a series of videos on back pain and sciatica. If you want to see the entire series, free, by the way, go to bobandbrad.com and go to the program section.
And it includes printout PDF paperwork that...
yeah, it includes a handout.
There you go.
That will help guide you along, so you don't have to keep watching the video. So, number one, when choosing a mattress, the first thing what we're looking for is that it's firm enough to support the spine, so that your spine is not sagging.
Right.
And so, ideally, you want a mattress so firm that the back is completely straight. So we got a little bit of a curve in, curve out, curve in. But you can see the spine is straight. You don't want it sagging in.
Yeah, if you an extreme is one of those mattresses that are old and there's like a bowl shape in the middle and you're sagging in there. That's extreme.
That's the extreme of bad.
Right.
Right. So, if I were to take a spine and I have a rounded out position here, and I push down into that, I'm sagging in like that. That's not what you want.
Right.
But for comfort's sake, you can't sleep on the floor or sleep on a board like this.
Right. That's not going to be, not going to be good.
The upper part of the mattress has to have a point where it spreads out the forces so that you don't get this point pressure. You see where you're getting pressure there, you're getting pressure there, you're getting pressure right on the sacrum, you're getting a lot of pressure on the knee. You're getting a lot of pressure on the heel. Your heel would break down after a while.
Right.
If you were in this type of
right. Your skin would, and that does happen with, especially the elderly, where the skin literally breaks down from mattresses that are too hard.
Right. So the upper part, you want the firmness on one part of the mattress, but the upper part, you want enough softness or that it spreads out the forces.
Right. It's forgiving here and supports on the bottom.
We'll show you this particular mattress that we like a little bit better.
Sure.
That we like better later. After we get done with the demonstration here. So they also had some research that they compared like firm mattresses versus medium firm versus soft.
Sure.
And I saw two studies on it. One was they did it in a hotel and they would survey the people afterwards.
Yep.
And without a doubt, the people that had medium firm mattresses medium firm mattresses were more comfortable than the people who had firm.
Sure.
Because for years, the doctors would say to you, get a firm mattress.
Right, right.
But it found out it was better for back pain than firm.
And the technology now for mattresses has changed for the last 50 years tremendously. So that may have some factor in it.
The other thing that we have found is kind of a rule of thumb. If you're a smaller person with less curves, like Brad and I really don't have big curves at all.
Well, I got broad shoulders, Bob.
Yeah. If you have less curves, you can generally tolerate kind of a little more of a firm mattress.
Sure, right.
If you have larger curves, and I'm going to show you why this is. If you have larger curves, let's take a person here. Let's say he's laying down like this, and he has kind of an ample buttock here region. So because the butt's up like this, he's going to have kind of a gap here, and that's going to actually sag down like this. So that's why you want to have a little more of a softer upper layer in someone who's large, so that it kind of provides some support in there.
Why don't you step off because you're
sure.
sagged there.
Oh, yeah.
Yeah, I know with me in particular, with my back issue, I can feel my sacrum sink in. And then I feel the support in my lumbar spine, which is very, very comfortable. It's very nice to have that support there.
Yeah. Let's move this over, Brad.
Oh, sure.
The whole board this way.
Yep.
And actually, I'm going to use that spine that you just used.
Okay.
And I'm going to put this mattress is the mattress that we advocate. We're not saying you need to go get one. There's plenty of mattresses out there that would work for you too, but this is the one we like. I'm going to show you, this is a small sample of the mattress. I didn't want to take it apart.
Right. This is what's inside of here.
This is what we like because it spreads the forces out. If we put the smaller spine on there, Brad.
Yep.
So this is what Brad was talking about. He likes this mattress because when he sinks, the spine stays straight, but he sinks in, and so there's support all the way along the spine.
And those curves. Yeah, so here's that top layer, the 2 inches of the foam that's soft and squishy, and there's 700 of them there, and then the spring layer on the bottom, which also allows airflow, so it's not so
Yeah,
warm.
the airflow is nice here along this, but it also show if you're laying on your side. Look at the point of the hip here, which usually is quite uncomfortable. That sinks in and spreads the forces out.
Right.
So that's why we like this particular mattress. Again, nothing that you need to get yourself, but I'll show one more demonstration, Brad.
All right, Bob.
We'll take this off. So just to show you that it kind of fits 2 guidelines, Brad, if you can hand me the weight when
Yes.
when I lay down flat on the mattress, you can see my back is completely straight.
Yes.
So I've sunk in enough that I'm completely straight. But yet, let's say I weighed a little more. Let's say I weighed, what is this again,
30.
Brad?
That's a 30-pound
Let's say I weighed
kettlebell.
30 more pounds right in my gut.
Mm.
All right, I put that in place, and look at what happens. Nothing. It still keeps my spine completely straight.
Sure. Yes, sir.
So this shows you that a heavier person can lay on this mattress, and it'll keep you in a line.
Maintain that posture.
So these are the things you want to keep in mind when shopping for a mattress, is that, you know, medium firm is probably better for back pain.
Mm-hmm.
If you are a smaller person with less curves, you probably can get by with maybe a little more of a firmer mattress.
Sure.
A larger person, maybe a little bit less firm, especially on the top.
Right.
So anything else you want to add, Brad?
The only thing I don't like about that mattress is I don't feel like getting out of bed in the morning because it's so comfortable. It just feels good.
Brad has spondylolisthesis.
Spondylolisthesis, I pronounce it, but
Yeah.
whatever.
And this has been the mattress for you. And it's interesting. We both got one. You know, they hold up well too. They're guaranteed for 10 years.
Right. Yeah.
But I have a different one in my cabin. And so when I go there on the weekends and I come back, I'm like, I remember how good this is. When I find, you know, you don't really notice the difference until you come back to it.
Right.
You're like, oh, it feels so good. So, all right. Thanks for watching.